Can you have a migraine without a headache? A question from one of our followers, and the answer is yes. There is a type of migraine called the silent migraine, or a migraine without a headache. There's another type of migraine called the classic migraine. With the classic migraine, you have auras prior to the migraine. Those auras are symptoms that can happen before the headaches. With a silent migraine, typically you will have the aura, but you never get the headache. The type of auras that you have, most commonly visual auras. So you can have loss of vision, zigzag lines in the visual field, flashes of light in the visual field, or you can lose partial loss of the visual field. Also, you can have tinnitus, you can have dizziness, you can have vertigo, you can have slurred speech, you can have numbness, tingling sensation, or weakness. So those are the symptoms that you have without having the headache, and those represent the migraine headache itself. Now, prior to this stage of the headache or the stage of the symptoms, you have what's called prodromal symptoms, 24 hours to 48 hours prior to these symptoms, where you have difficulty concentrating, fatigue, tiredness, sensitivity to light, sensitivity to noise, nausea, vomiting, even the continuous dizziness. Those are called the prodromal symptoms that can precede this aura 24 hours to 48 hours prior. Also, there's another phase, what's called postdromal, which is after those auras. You have also the constant dizziness, concentration problem, fatigueness, tiredness, and difficulty or excessive sleepiness. So the diagnosis of silent migraines is based on the clinical history done by a neurologist, and typically it's difficult to diagnose because there is really no headache. So it's based on the clinical history, based on the neurologic examination. The neurologist might order an MRI of the brain to confirm other pathologies that might mimic those symptoms. When the diagnosis is made, then treatment begins. How do we treat it? We focus on avoiding triggers. As any triggers for other migraines, there are certain triggers for those silent migraines. It could be stress, it could be lack of sleep, it could be certain food or certain drinks or caffeine. So if you avoid the triggers, then the headaches or the silent migraines will improve. Then after that, we rely predominantly on preventing those symptoms. So we use medications similar to any other preventative migraine medications to prevent those symptoms. We can use Topamax, propranolol, amitriptyline, nortriptyline, all of those medications to prevent the auras or those symptoms, and therefore you get rid of them. And at times we can use abortive therapy, specific abortive therapy, to stop the symptoms that the patient is having. So silent migraines is essentially having a migraine without a headache. They exist, they require diagnosis, and they can be treated. Thank you.